Hi there, everyone. Welcome. Welcome to the Concerned Friends Long-Term Care Education webinar series. This will be our second event of the year, and I'm so pleased to have you all with us. I would like to do just a little bit of housekeeping before I kind of launch our full program. And as you are all getting into the space and preparing yourselves, this will hopefully be helpful to know. So first, the webinar is being recorded and will be available post-session. So we'll be sure to send that out to you, along with some other, great tidbits of information. You can enable closed captioning if you need it. Should be just down in your menu, usually under language. There will be a discussion portion of our session today, but for the most of the program, we're going to ask if everyone can just be muted during the kind of early remarks and during our speaker's presentation. And the chat will be enabled for posting questions. If anything comes up that needs to be immediately addressed, I will make sure that that information gets shared along with our speaker. Finally, we are doing something a little bit different because our speaker today has written a really impactful book that we want to share with, here it is, I have my prop ready to go, that we want to share with you. I am donating 2 copies that we will draw after the session is over based on who's attended, and we will draw 2 copies and we'll reach out to the winners via the email that they have identified in their registration to find out how we can get your copy to you. So I'm super excited to mention that we have this sort of special thing this time, which is a prize draw. So now that I've gotten the housekeeping out of the way, I'd like to introduce myself. For those who don't know, my name is Crystal Callisto-Taveras, and I am the current chair of the Board of Directors for Concerned Friends. Concerned Friends is an organization that operates primarily, in fact, province-wide in Ontario. And our work takes place on the traditional Indigenous territories, covering 46 treaties and other agreements in what's now called, of course, Ontario. I'm coming to you today from Treaty 13, Dish with One Spoon Territory, also known as Toronto, the traditional territory of the Anishinaabe, including the Mississaugas of the Credit, the Haudenosaunee Confederacy, and the Huron-Wendat, recognizing that this land today is home to many Indigenous, Métis, and Inuit peoples. I'm very grateful to be hosted here and have the opportunity to advance Concerned Friends' mission of care, equity, and dignity for all seniors residing in long-term care homes. And Alexis is just going to post a little bit of information for you to explore the territory in which you live. And I think now I can kind of set the stage a little bit for our session today and for Concerned Friends, for those who may not know a lot about our organization. So we are a volunteer-run charitable organization. We've existed now for over 40 years in the province of Ontario. We have a mission to improve the lives of Ontarians living in, working in, and involved in long-term care. And I know with 40 years under our belt, that is a lot of history, and it is actually an incredibly important legacy. And for those who may not know about our history, I'll just kind of provide some very specific highlights, and just a few because it is 4 decades worth. So we advocated for implementation of a framework that is now the Residence Councils. We championed the Residents' Bill of Rights that was implemented in 1987, issued the first report card for Ontario long-term care homes, in 1991, that contributed to the mandatory public posting of inspection reports in each home to ensure accountability. We launched the Family Council pilot project in 1998 that in 2004 became sustainably funded by the Ontario Ministry of Health and Long-Term Care. We've helped hundreds of Ontario seniors and their families navigate the complex long-term care system to find information, resources, and to have any issues or complaints or care needs addressed through a service that we call wayfinding. We've spotlit critical issues during the COVID-19 pandemic to ensure public awareness of what was happening in long-term care and advocated for action. And more recently, we launched an inaugural Long-Term Care Awareness Day in November of 2022. We had our second one in November of 2023. And that was designed to mobilize Ontarians toward direct action to advocate for improved standards and better accountability. So we are a charitable organization. We welcome donations. We welcome new members. We welcome volunteers. We're all volunteer run, except for our wonderful coordinator, Alexis, who is the only paid part-time staff that we have. And she moves mountains in the very little time that she has to do that. So all of our resources, programs, webinars are offered free of charge, and we would love for you to continue to engage in our community and find ways to let your voice be added to ours. So the purpose of this series, we wanted to create something kind of short and sweet that could engage new voices, bring new perspectives to talk about long-term care and different aspects of it. We know that the system is very complex, it's confusing. We know that there's often a lack of information or just not the right information at the right time. And part of our mandate as an organization is to offer awareness and education opportunities. And so that's what we're doing here. And we wanted to make sure that everybody had access to it, not just our members or direct supporters. So this is open to the public. So now I'm really thrilled to pause, and you'll probably not hear from me for a little while because I get to introduce our esteemed guest speaker for today, who, by the way, has just traveled quite a long way and is just kind of getting situated in her time zone. So we feel so grateful that you were able to provide us with this dedicated time, Kim. Kim Samuel is a leading voice in the global movement for belonging. She is the author of On Belonging, Finding Connection in an Age of Isolation, and an exploration of the crisis of social isolation and humanity's right to belong. It's a beautiful book and has so many unique voices and perspectives included in it. So I'm really excited for her to share a little bit more on that. She's also the founder of the Samuel Center for Social Connectedness, a research, advocacy, and action group that partners with and convenes leading academics and changemakers to combat social isolation and build belonging around the world. And she's also got, of course, so many other titles and wonderful things that she belongs to and is spearheading. But I know she'll be able to tell it a lot better than I will. So maybe I can just pass the mic to you now, Kim.
Thank you very much, Crystal, and welcome to everyone. I'm actually in New York City today, where I don't live. I come from Ontario, from Oakville, and I was recently in South Africa just 2 days ago this time. So if I sound a little croaky, it's because I am a little croaky today, and I'll hope that you'll just bear with me. But as it happens, I'm coming home next week for the third birthday of my granddaughter and her parents and baby brother who live in Erin, Ontario. Anyway, it's really a special joy for me here to be here with you today. And I want to really start by expressing my gratitude for the opportunity. I'm pretty lucky in that I get opportunities to speak in different places around the world, but I haven't had the opportunity to speak enough at home. And so I'm hoping that today is that I'll do a really good job, that as well as that maybe it will open the gate to others. And I also wanted to say, Crystal, and this isn't to take anything away from the prize winners in the draw, but if anyone's interested in reading my book, which you don't have to be, but if you are, I was just speaking with my colleague who's on the phone, or sorry, on the call with us, Catherine, to make sure that we have enough. So I'd like to offer to anyone who would like to read On Belonging, where I actually do talk about some of these issues. It would be my pleasure to have Catherine Jansen organize how to get them to you. I just wanted to put that out there.
Thank you, Kim. That's amazing. That's very generous. Thank you.
Okay, and also thank you to Isabel for helping for me to be here today. I want to start using, I guess, how to begin a word that has a lot of different meanings, which sounds funny because you won't think that when I say it, and that word is family. And I'm going to begin by telling you a little story about mine. But I also think about family in the way that a friend and mentor of mine, Eunice Kennedy Shriver, who passed away many years ago, made a huge impact on the world by creating Special Olympics. She once said to me, Kim, there's nothing more important than family. So if you don't like the one you got, go get another one. Now, I like the one I got, by the way, but I also like the ones that I get to create, some for a long time, some not for very long. But when I was thinking about the theme of long-term care, it occurred to me that we're making, at whatever stage we are in life, and whether we're there as a resident in long-term care, or a spouse of someone who's in long-term care, or a child, or a family caregiver, or a professions. And I don't mean the word professional in a negative way, but I mean people such as nurses and others in the field that go into this field with a real desire to care. And that we all have to be in this together, because even today there's still a lot of challenges to be able to give people the care that we want to be able to give them, and also to put their own voice at the center. Okay. Just over 25 years ago, my father, he was called Ernie Samuel, fell into a 3-month coma out of the blue. Even today, they don't really know what happened. It was called a severe intracranial bleed. And then he woke up about 3 months or so after, and that was a very slow and long process. And for me, I think for all of my family, he was as whole as ever. He loved his family and his life, and he met his physical and social challenges with determination and grace, even as he was treated as if his identity was defined only by his medical condition and his age. People around him, outside of family, close friends, the inner group, didn't always seem to see him as a whole person. And I witnessed the isolation that he felt as a result. And my mom, who's also since passed on, Elizabeth Samuel, who had gone from, they had gone from each other's main title as spouse of over 40 years. She was now called the primary caregiver. I still look at isolation as this feeling of sitting all alone at the bottom of a well, and it went directly to what happened to my dad. So we were really surprised when his workplace insurance provider rejected plans for rehabilitation, claiming that since he was 65 years old, he was now in his sundown years and therefore not worthy. I want to point out that I'd still be riled about this if he'd been 95 years old. This was a fancy way of saying that he was too old to be worth the cost of treatment. We were fortunate that my family had the means to pay out of pocket for rehabilitation. Even at that time, this was in the late 1990s, just for a bed was $2,000 a day. But the experience shifted the ground from under me, and it was a turning point in my life. I started to think about all the varieties of social isolation that exist in the world, not just loneliness, but the tendencies to see people as other or less than. I thought about how these tendencies compound other challenges like poverty. I started thinking about how these forces are widespread, but have disproportionate impacts on older people. And I started thinking about this overarching question: How do we move from systems of separateness and isolation towards systems of connectedness and belonging? And I realized only that this would be the question that would define my life's work. I should also mention to any of you who know or who have raised daughters and went through the teenage years where school projects might be about doing some kind of a history of your family. I always wish that I could tell my daughter that I sold shoes because shoes are important, right? And I couldn't really explain what I did until that moment when I realized this is what I'm supposed to be doing. So today around the world, there's a growing recognition of the challenges that I'm talking about, as I'm sure you all know. As the World Health Organization underscored in a recent announcement, loneliness and isolation are now a clear and present danger to human health. And loneliness now impacts an estimated 1 in 4 older people. I also, if I say older people too much, it's because in other parts of the world where I seem to find myself a lot these days, that's more the term than seniors, but we're talking about the same group. Okay. A report by Canada's National Institute of Aging, released in December, found that around 41% of Canadians aged 50 years and older are at risk of social isolation, and up to 58% in that age group have experienced loneliness. The 2023 Canadian Social Connection Survey found that 53.8% of respondents between 60 and 78 years old, and 50% of respondents aged 78 and older reported being lonely. A major study measuring objective levels of social exposure between 2003 and 2020 found that a person's average time spent alone increased about 24 hours per month during that time. And it goes without saying that the pandemic has rapidly accelerated those trends. My research shines a light on some of the specific implications of social isolation for seniors. I recently founded a new initiative called the Belonging Forum that engages in high quality, solutions-focused research, in brackets, trying to make a difference, on the state of isolation, as well as strategies for building belonging. And this spring, we released the findings of our first ever belonging barometer, which was a survey of 10,000 people across the United Kingdom. We found that only 34% of those who are not satisfied with the quality of their friendships are satisfied with their life overall. Life satisfaction doubles to 78% for those who are satisfied with their friendships. This clarifies the challenge facing older people, many of whom are dealing with the losses of spouses and friends, or the isolation of living in a long-term care facility away from the traditional camaraderie of work or community. You've perhaps heard the widely publicized estimate from Dr. Julianne Holt-Lunstead that loneliness equates to the health effects of smoking 15 cigarettes a day. Recent studies have found that loneliness can impact the quality of sleep, and in many cases impact individuals' propensity to engage in behaviors like smoking, excessive alcohol consumption, and sedentary lifestyles. Recent scholarship finds that loneliness is a chronic stressor, that a deficit of human connection drives ongoing activation of the body's stress response systems and the sympathetic nervous system. It drives dysregulation of the stress hormone cortisol, and this can have downstream effects on metabolism, immune function, and cardiovascular health. Such stress drives profound physiological changes. The psychiatrist and behavioral scientist George Slavich at UCLA underscores that social isolation places human beings in a state of threat, and that we are wired neurocognitively and immunologically to respond to that threat in ways that substantially impact morbidity or mortality. Just need a little water. Okay. When we hear the statistics about rising isolation today, it's partly the absence of friendship and everyday social ties, but it's also, as I've come to realize, the systemic effects of trust that emerge when we other people turn them into less than. The physical and psychological walls that keep us from forming bonds or building community or engaging authentically, with one another. It's the loss of trust that leaves people in a state of threat or stress. And I just want to point out that this doesn't mean that someone actually at any given moment is under threat any more than when I talk about the feeling of sitting alone at the bottom of the well. I'm not saying that the person actually has to physically sit at the bottom of the well. I guess what I'm saying is that if that's how we are experiencing things around us, that's how we're going to process everything. In many cases, isolation can mean the denial of agency, our voice, our choice, or even our ability to be seen. Such isolation can be fatal. In late 2022, the CBC reported that a woman in a Canadian long-term care home died after a worker tied her call cord out of reach. The woman, Kathleen, moved into the residence a decade earlier after suffering a brain aneurysm. She had anxiety and was known to pull at the cord regularly to call for assistance. On the day she died, the workers tied her cord out of reach so that she couldn't call for them. Shortly afterward, Kathleen went into medical distress when her oxygen tubing fell out of her nose and she was unable to put it back on. She couldn't reach the cord to call for help, and she died there alone. This too is what I mean by isolation. It's a systemic crisis, and it's one of the overarching challenges facing humanity today. I know that I've laid out some very serious and very disturbing problems that we face, and I suppose it goes without saying that what I'm talking about, including that gruesome story, is not a one-off and doesn't only happen in Canada. But I believe as Canadians, we're especially attuned to do better. So I'm also here to talk about solutions and hope. Hope is really important. I believe we can overcome the crisis of isolation in many of its manifestations. And I've now spent over 2 decades as a researcher, convener, advocate, and teacher focused on how we can do so. I've interviewed hundreds of experts and people with important lived experience to gain insights toward this end. I've also interviewed several people who happen to have dementia. And I think this is really important too, to hear about someone's lived experience and how their day is. And when I was in South Africa recently, I got to be, I would say, the third least interesting panelist, not to put myself down, but the other 2 panelists were people with dementia. And they were in the category of, they were octogenarians, well over 80. And they'd been chosen by their peers to talk about isolation. And there was a man and a woman. And when the gentleman got up, he said, "I would like to tell you something. You may notice it anyway, but I have dementia. And this lady over here knows it, and so in here, and my friends here know it. So if I lose my way when I'm speaking, someone will pull me back, and I'll carry on." I've never been in a, now I want to do this all the time and also make sure that people like everyone coming to speak and share their experiences, feel really supported. And they're not only there to share their experiences, but also their voice. And in this case, the government's check, I guess, I don't know that I would call it a pension, but it would be like that, which is really important there, anywhere really, but there because so many older adults have come through apartheid. They have no savings. And the check hadn't come, and this gentleman and the group there were a couple of groups coming together had gone with their helpers and supporters, but they went to advocate and say what was wrong. And I feel like that's a clue, and hopefully something that would be of interest, or perhaps is already being done at home. I don't know, but I'd love to learn. It was a powerful moment for me. Anyway, through my work, I've arrived at a very modest theory of change to address the challenges of loneliness, isolation, discrimination, and alienation. We need to affirm that people have the right to belong, not only that we need it, but a right. And what I mean by that is by simple virtue of the fact that we are born, which would mean everyone, we all have an inherent right of belonging. And yet when we look at how that plays out for different groups, whether it's age-wise or gender-wise, and we could go on and on and on. I'm in New York City, and there's a much larger population of people experiencing homelessness than pre-COVID. And I'm just wondering how much they feel like they belong when people just walk on by and don't even show care. So we all have it. To me, it's a birthright. And I believe that we need to build systems of belonging. And so we could all, I'm sure all do have a definition of belonging, and I'll throw out mine, but everyone here will have their own words for it. I'm just starting us off. At one level, it's something subjective. Each one of us knows for our own self what it feels like to belong, to experience wholeness, to experiencing being in the right place. Take a moment to consider the question for yourself. What does it feel like to belong? Beyond the subjective, belonging is also something we can understand systemically as a set of factors that can be cultivated in our lives and our communities. Through decades of studying this topic, I found that our personal sense of belonging can often be understood as our connection to 4 core dimensions, which also have the advantage of starting with the same letter. So I find them easy to call up at any given time. People, place, power, and purpose, the 4 Ps. It starts with people. As recent medical and scientific research demonstrates, interaction with other human beings is a bedrock human need. Yet it's more than just simple interaction. Building belonging means cultivating recognition and respect. When we have belonging, we have relationships that are rooted in reciprocity. And I'd like to just hang for a minute about reciprocity. It doesn't just mean, oh, well, I'm going to give something to Crystal, like a book, and now Crystal has to give me a book too. That's not what it means. Don't worry. It's this spirit of something where we're constantly giving and receiving. And I think this is really important in care, because I think that the designated receiver of care or needer of care, and looking at my parents, is one point, but also the one that is the designated in that moment caregiver also needs to feel supported too. And often, as I learned very poignantly with my sister Tammy, who passed away also many years ago, that the only person that helped me get through losing the greatest sister in the world to a terminal disease was that sister. So I really talk about reciprocity in caregiving, because I just think it's essential. Belonging can also come through connection to place. When we belong, we feel at home on the lands and ecosystems on which we live. We recognize that we depend on these places. And when we feel a sense of belonging in a physical place, we feel an intuitive commitment to preserve it. Belonging can also come through connection to power. Belonging is not a passive state. It's about understanding and being understood. It's about having the capacity to envision and shape a shared future. And at the same time, never losing touch of that person you're with right now, to be able to say, or at least know, that I see you, I respect you, you tell me about you, and I will believe you. And all I ask is the same in return. When we belong, we have agency and influence over the systems that govern us, whether that's our workplace, a city, or a school, or even a long-term care home. This relates directly to the dimension of purpose. 20 years ago, I had a brief conversation with Nelson Mandela, one of my heroes, in which he explained to me that he was never isolated, even over decades as a political prisoner, often in solitary confinement on Robben Island, a secluded rock in the Indian Ocean. Mandela told me of his time in prison. We were all brothers working together with a common purpose. I was never alone. But he also told me that he had seen isolation, and he had seen it in a village in Africa where children were not cared for, where they had no food and no clothing and no love. Now, his example was at that moment was he was referring to AIDS, but I think that those words are true anywhere that people are suffering. There's the thing that we can't stop, which is a measure of suffering in all of our lives. And at the same time, we can always come in and ease someone's suffering, but we have to see them as whole first. So this for me is a profound example of how a sense of purpose can enable a human being to transcend even the most isolating circumstances. So people, place, power, purpose. These are the 4 dimensions of belonging. Most everywhere I go, people think of many more really important letters starting with P. So please offer any up. As I say, that's my beginning point. This idea of belonging isn't some distant vision to strive toward. It's our birthright. It's the essence of well-being for people everywhere. That's why I believe each and every one of us here and each and every one of us everywhere, people we know or will never meet, equally possess this inherent right. The belonging framework is a theory of change that we can use to defend and uphold the rights of all people. And this includes the rights of groups that have been historically neglected by government policy and community care initiatives for generations. And I'm talking, of course, about older people, about seniors. COVID revealed the harsh realities inside many long-term care homes, with people living in these types of facilities counting for a disproportionate number of pandemic deaths. And this includes many tragic and preventable cases, like the story of Kathleen that I shared earlier. And I'm not for a moment defending or making better what happened to her. It's also to ask us to consider what kind of enormous stress the team, the staff there must have been under to not feel supported, to not have enough people on a shift, to not have mentorship and training on their own. So I really think to solve any problem, and that was an extreme one, but not the only one, there is some compassion needed in all directions and some changes too. During the depths of COVID, many older people were largely abandoned left isolated in institutions. I'm not only talking about Canada. There were already, in many cases, breeding grounds for loneliness, systemic vulnerability, lack of agency, and deprivation of belonging. And we can do so much better. Imagine what it could mean to transform life in care homes and life for older people more generally into a state of richer connections in terms of people, place, power, and purpose. Imagine that people have robust, meaningful relationships with others rooted in reciprocity. Imagine that people feel a deep connectedness to the places where they live. And not only where they live, but also to the community that they are a part of. I met recently in Boston with a group of self-advocates with disabilities of a lot of different ages. And two of the people that I met with had were seniors, and they had spent most of their life in institutions, and then they were good friends, and they had finally been allowed to go live in a care home, in a community home, sorry, and I was ready to clap. That's so great. And they said, it's not so great. We want to blend and be with other people. We want to go to the market. We want to do this. We want to do that. But we're kind of literally up there, up the road, up the hill, and nobody wants to talk to us, and no one's making an effort to bring us together. And they're still not able to use the bathroom without asking permission. So when I talk about that agency and control over their circumstances, I think that's a really important point. And going back to my father, when he was in a rehabilitation hospital, the person that was the designated patient and the primary caregiver, in this case, mom and dad, were not ever included for anyone there in the team meeting that happened every Friday. And those are the ones that are going home. That's where the care is going. And I was able to go to the head of that hospital and make a strong case that there was a better way to do it. And that's another thing I want to point out, is that we have to keep trying out new things, because I find a lot of times the people that are easy to say, that's what's wrong, are in the same position as we are, not having the adequate funding and the adequate policies in place to be able to meet the needs. And imagine that people can experience a sense of meaning and shared purpose. Today, it's only in exceptional cases that people in long-term care facilities have these conditions met. But we can and should think big. What would it mean to enshrine the right to belong for people in long-term care? I know that you, as concerned friends, are already doing vital work to build belonging in long-term care homes. This includes creating opportunities for social connection, time in nature, chances for residents to be involved in decision-making. And I know that you have a tremendous breadth and depth of experience and commitment to share. And I certainly wish that I'd known you when my mom and dad were still alive. And I want to hear from you about your efforts and your ideas for achieving this vision. I most certainly do not have all the answers, but I'll begin by sharing a few possibilities. My friend, Dr. Paul Farmer, who passed away 2 years ago unexpectedly at age 62, was a celebrated physician and public health expert. Yet his great specialty was in imagining and building holistic systems that support dignity and belonging. I first met Paul about 20 years ago in Rwanda. And this is when I first started working in collaboration with Partners in Health, or PIH, the organization that he co-founded with a group of fellow physicians and activists in the late 1980s. Their stated mission then and now is to bring the benefits of modern medical science to those most in need of them, and to serve as an antidote to despair. PIH now works in 12 countries with more than 18,000 affiliated staff to make healthcare a human right, giving preference to the poorest patients with the greatest needs. And over the years, Paul and I shared many conversations that helped shape my thinking on a range of topics, from leadership to medicine, to the relationship between human beings and nature, to the importance of social connectedness in health. The most important thing he imparted to me is that we can build systems of belonging in caregiving. One specific principle that Paul taught me for building belonging is to expand the circle of care. In Ontario, as I'm sure you know and probably have more updated statistics than I, Crystal and colleagues, more than 43,000 people are waiting for long-term care. The wait list has nearly doubled over the past decade, and it is expected to grow, reaching 48,000 by 2029. Long-term care homes do not have enough staff because of the severe health human resources challenge, crisis happening in the broader health system in Canada and around the world. For decades, Partners in Health, which is also in Canada, has been expanding the circle of caregiving by training local people in low-income contexts who don't have substantial prior medical education, people with caring hearts who might not otherwise be given a chance to serve. These people become community health workers who conduct home visits, teach preventative healthcare skills, make case findings for medical providers, and consistently check in on people with specific needs. And they don't have to be in and out in 10 minutes. Across different countries, community health workers, or CHWs, focus on addressing the interdisciplinary causes of ill health, connecting people not just with medicine, but also nutrition, clean water, education, housing, transportation, safety, and emotional support. In long-term care, it seems to me like we need a major influx of investment dollars into staff capacity building. We need significant staff recruitment, which means supporting our education systems to attract and train enough healthcare experts who can care for our loved ones. And of course, the best care will come from us. But we're not always in a position to be able to queue up a family member from that person's family with them. And that's what I love the term and the ethos of concerned friends, is that there's lots of ways to make up that family. By training people without traditional medical education to be skillful supporters of people's health needs and investing heavily in creating a culture of service, PIH has created communities where there is abundant care and widespread connection. This is an example of expanding the circle of caregiving. A second principle for building belonging in long-term care is caring for caregivers. I wrote a whole chapter. I could have written a whole book on this, but I did write a whole chapter on this in my book, and it was based on two people, Lionel and June. That was the middle names of my parents. My dad would be really annoyed if he'd known I'd done that. He never wanted Lionel in the first place. But it was about a couple that could have been them, where he was Lionel was at the end of near the end of his life, and was struggling valiantly but living. And June also had a major illness herself, and people would say to them that, or they'd say to June, you're a brick. Let us know if there's anything that we need, or that you need, anything at all, which basically did not happen in our family. I hope my late parents would agree. But it would have happened if and it did happen by a lot of people that had been friends or others, that they would say, Liza, her name was Liza, you're a brick. Let us know if there's anything you need. Liza, you look really exhausted. Should you be smoking so much? Where do you, and my mother at the time, I'm so proud of both my parents, she was the chairman of the ROM, the Royal Ontario Museum, which she had to stop she wanted to, but to take care of my dad, but nobody really asked, how did that make her feel and what did that mean for her? And but in my Lionel and June story, then Lionel passes on, and then a lot of people come to June, and with food and things and care, and they come to the wake, if there's a wake, or what the visitation, there's a visitation, and then to the funeral. And Liza, listen, if there's any, you look exhausted now, whoa, but if there's anything you need, you call us. And the thing is, when we're feeling isolated or we've gone through a major loss, it can be really hard to say, this is what I need you to do for me today. So we've got to figure that one out as well. I also, I do and I don't make a distinction. I do make officially a distinction about people that are, for example, that are nurses, and there's so many different caregivers, what I call professional caregivers. I also look at teachers in this way. I'm not saying that family caregivers are not professional at all, but I wish that the caregiving community would really respect the family caregivers more and what they're dealing with, and value them better. And certainly for within the so-called system, people also need to be recognized with proper compensation. These workers also need access to the right tools and resources to provide quality healthcare, and they deserve it for themselves too. So in a society that's truly built on belonging, caregivers would be well-trained, well-equipped, and well-compensated, and well-appreciated. They should receive well-being support services to help bear the weight they're shouldering. And ultimately, I believe they need to be recognized and respected for the importance of what they do. And in a system of belonging, caregivers are enabled and empowered to give their gifts, to offer the world what they've been called to offer. A third principle for building belonging in the long-term care context is to weave connectedness into medical care. Social prescribing is an increasingly popular approach in healthcare, and you've probably all heard of it and probably are doing it, even if you didn't have that term. It's what you do. And this is where medical and health professionals connect patients with non-medical community services and activities to improve their overall well-being through social connection. Instead of only addressing physical health factors or even traditional mental health factors, social prescribing recognizes that social factors like the quantity and quality of relationships can significantly impact health. For isolated older people in a long-term care home or wherever they live, social prescribing can be an important tool. By linking residents with group activities such as arts, community exercise classes, or especially volunteer opportunities and intergenerational activities of all kinds, including just playing together or reading and so forth. Social prescribing helps older people overcome diverse challenges. A fourth principle to build belonging in the long-term care context is to focus on power and purpose. Building belonging requires work with older people to co-create solutions rooted in agency and dignity. And this is the essence of supported decision-making. When the Global Convention on the Rights of Persons with Disabilities was being crafted, we often heard the long-time mantra of disability activists around the world, nothing about us without us. And I think this is really important here too. We need to lift up the world of long-term care to show that this isn't something over there when you get older or you get ill. It's really what we should be doing as human beings all the time. And that same ethos must be present as we create better policy and programming with not for older people. And in terms of power and purpose, it also gives the added impetus for people living in long-term care homes to contribute to the greater good. Think of people who have retired from their careers and may have limited engagement with family, but still have the conditions and the desire to serve in diverse ways. And I know we all have something to contribute. I wanted to do a check-in, Crystal, because I hope there'll be time for conversation. So I've got a bit more. Or would you like me to wrap this up? I need some guidance from you.
Yeah, sure. Well, I think I would love to leave, maybe a few minutes for any questions or
Okay,
comments from the group. So if you have, just a final piece to say, but I am noting the time is about eight
right,
minutes to the end.
right.
So
Yeah,
yeah,
my peripheral vision isn't great, but
it's okay.
nor is my regular vision. I was noting that as well. So I think I'll just come to the end and to say that today, really all that I can do is to share, and I've got more to share. I've got lots to share, but in the end, in everything I do, I just feel like I'm one person, and if I can hold up the space intentionally, which is enough work for a full-time job, for the space that the people who really own that can come into and thrive in, then I'll have done something useful. And so I want to be clear that there's nothing I'm trying to tell anyone today. I'd love to join. I'd love to join the organization myself, actually, and to not only advocate for seniors, but also encourage and give opportunities for seniors to advocate too. That's where I think the best leadership comes from. People know what they want and need, and also work on mindsets to break away these barriers between what is called a care facility or care home and community outside, or between what do we think is older and what do we think is younger, and who do I think I need to give help to, who's really the one who's helping me. And I'd like to just finish with an adage and suggest a change to this adage. You know, the adage of a seat at the table, having a seat at the table. And it's really important. And I always say, yes, it's not just that you have a seat at the table, it's that, are you being heard? Do you have agency and voice and choice? But today I wanted to just end, I just was thinking of it as I was speaking with this thought, is that when it comes to seniors, to older people, they don't just need a seat at the table, they are the table. And then it's for the rest of us to sit at that table and invite others to sit there and support and fight and care and love. Thank you.
Thank you, Kim. Thank you so much. I know I have so many questions, but because this is not just a conversation between you and me, and there's others here, I'm noting that there are a couple of hands raised. So I'm going to pass the mic to Sharon Lee, if you want to go ahead.
Yes, thank you. First of all, Kim, I just want to say thank you so much for your presentation today. As a board member of Concerned Friends, everything you said today, I can totally reside with, because my father just recently passed away and he was in long-term care. And everything you said just resounded with me about how there was no respect for what I was trying to do with my family for him. And there wasn't enough care at the long-term care. And there's a lot of dysfunction there, and so I just want to say thank you for standing up and sharing your voice and giving all of us an opportunity to say that we're not alone. It doesn't matter where you come from or where you live. We all have that shared experience, and I'm just very grateful that you gave us a shine a light on this matter, because so many people think, well, they're just old, but our population is getting older. And I want to think, and I think you're probably on the same track, is that by the time it comes for me to go, I don't want it to be fear it. I don't want to think, oh my God. I want to think, wow, I'm going to go to a nice place. People are going to care. They're going to take good care of me. And I don't want to go with a fear. So thank you very much.
Sharon, just to say thank you, and my condolences on losing your dad. It doesn't matter how old we are. When you lose your mom and dad, it's
Yeah.
massive. And also, if I can just add, when we go, what I want for everyone, not to go too soon, but when we go, I want there to be, and for everyone, and hopefully it's there someone that really loves them, like you, like family. But I think there needs to be one hand, one human hand in their hand as they go, so no one ever has to go alone.
Mm-hmm. Thank you.
Thank you, Kim. Thank you. So I see another hand up, and I'm so sorry if I mispronounced your name. Is it Kirsten? Oh, and maybe that person disappeared. Sorry, I don't see
There
them
you
on.
go. There we go.
Oh,
I'm on
okay.
now. Yeah, great. Yeah, you got it right. Thank you very much for that. It was super educating, because I actually take care of a couple that they reside in I call it a retirement center, not a nursing home. And they were promised a suite, not a room. I changed those words because I said to them, it's all about language. You have to use the proper language. Because I think that's important, because they call the continent pad a diaper, which is not. And so they were promised a suite together, and they have two separate suites. And so I know that I go in because I don't have any, I'm not a family member, so I can really speak out because I don't have anything at stake personally. Other than that, they're my friends. I'm going to make sure they're taken care of. And so I always tell them that it's super important to use the proper language, because they might be seniors, but they're not stupid, and they can hear what you're saying. And so, yeah, so it's really important it gives me some education about how I can maybe advocate a little bit more, what's the word I'm looking for, firmly, but more professionally as well.
It
So
sounds, yeah, no, thanks for sharing. It feels like the three of you are lucky to have each other as friends, and just to say, you raised a point, not me, you, this point about how to get more when you need to go in and advocate. How do you do it? How do you do it? And I think that there's my case, I just was so mad one day. I walked up to where's the head of this hospital. I knocked on his door, and that day it worked. I'm not saying it would work every day, but it's good, also to have mentors and people that are going through what you're going through. You don't have to be a family member to care, but also then how to advocate and how to do that well. I feel like that you can't just leave it for people to figure out, there should be support there too.
Absolutely. Absolutely. Okay. I think we have one last question before we wrap. So Abdur, if you would like to share your question.
Abdur I see is muted on the.
Okay. You know what? Maybe hang on a second. Okay, I see the question here in the chat. So if it's okay,
Okay.
maybe I'll just share the question quickly.
Sure.
So the question sort of says, how do we deal with spirituality in long-term care homes? And I'm wondering if in particular, you might be able to speak to the connection between social connectedness and spirituality in the context of long-term care.
Yeah, first, thanks, Abdur, for the question. I don't get it nearly enough. I think that in terms of, I'm going to go right to faith. Whether someone has a faith or a religion that they practice, or none at all, we equally have I believe a responsibility and a care for that person. If you are a person of faith, and I'm saying faith, I could say spirituality too. It's just that I look at faith as that something bigger than us, that we kind of know is there, and maybe it could be called spirituality, or maybe it could be called imagination, or maybe it could be called what our Druid ancestors called God. God was a tree. That was a tree. But I think that it is very much related with belonging and connectedness for people who have spirituality or have that, again, a faith, something bigger than themselves. And at the same time, everybody is welcome. But I do think that there's a clinical setting anywhere, such as a hospital. It varies on the home. My late grandmother, now I'm going way back, she spent her last years, it was a farm, and there was a wonderful woman, and she had this kind of home at her home, and there were 8 residents, and it was perfect. And there was you felt something there, and others you can feel like, oh, are people just here to die? And I think it has to do with what the energy is going into it. But I think that what we need to do is, again, simple, I guess. What I'm saying is we got to meet people where they are. And so I can't say to somebody that, oh, why don't you come to church with me, or why don't you volunteer? You don't volunteer enough. It's not about that. I'm here for me, but if there's love flowing through me, and there's love, I think we get to choose every day it's all flowing through us. Which way do we want to go? Then sometimes it comes down to a kind word, or caring, or always making sure that that someone who is all alone isn't all alone, even though you may not become their best friend. I'm always on the lookout for the person who's all alone at the back of a room. Of course, you don't have to be that way to be lonely. And sometimes I'm told, hey lady, I'm on my phone. And okay, but sometimes you're just the guide for them to get them started. And that could be in a new community, a new place. I think about all these things. But in terms of the spirituality part, that's actually something that as I go through my life's journey, as we all go through our life's journey, I'm starting to look at that. Why is it that we can't talk about spirituality or faith, or however we can talk about community, but we can't talk about what it is that brings us together? And so it's something in the watch this space, but it could be a few years from now, but I want to address it. So for Abdur and for Crystal bringing that question out, big thanks. I don't know how I did answering it though.
Thank you, Kim. Thank you so much for being here today. Thank you for starting this conversation, I guess, for us. A topic that I'd mentioned to you has not yet been covered within the Concerned Friends community, but we knew that we had to, and it's so important. And so thank you so much for that. Thank you for everyone who has attended today. I do want to let you know that we have a couple of upcoming opportunities for you to engage in, including our AGM. So I want to extend a personal invitation. I get to do that as chair of the board, apparently, to attend our AGM on June 13th, 7 to 8:30, I believe it is. And we actually have another speaker joining us, Alex Spanko, who's going to talk to us about small homes. So this movement toward away from facilities and towards small homes in the long-term care sector. And he comes from the Greenhouse Project in Chicago. So I think we'll have a really good time of that. We'll make sure that the registration information gets out for that. And we also have a launch of a campaign that we'll provide a little information on. And of course, not to be forgotten, we will make sure, for those who would like to receive a copy, we will make sure that we get your information to Catherine and company, and we'll make sure that those books get out to you. So thank you again for joining us today. And if you like the work that we're doing and would like to, attend more of these, we would love for that to be the case. So please feel free to go to our website, become a member, volunteer with us, make a donation. We would love it. We love to be part of these conversations and to bring them to you. So thank you for being here. Thank you, everybody.